Hi, everybody, and welcome to the podcast series on innovative healthcare solutions that's sponsored by the Conference of Consulting Actuaries, or we just call it the CCA. Now, I know some of you have seen these before, but if you remember these podcasts, they're a series of interviews with actuaries and other professionals that are focused on delivering innovation in healthcare. And these sessions are, really trying to provide some insights about what's transpiring in the ever-changing field of healthcare in which we live. Um, as always, I'm Ed Pudlowski, I'm president of Morningstar Actuarial Consulting, and I'm also chair of the healthcare community within the CCA. And I'm going to be your host for today. Now, I'm really delighted to be joined by somebody who I've known for quite a number of years, and that's Lennox Cornwall. Lennox is an independent broker with the Cornwall Agency. Lennox, thanks for joining us today.
Ed, I'm very grateful to you as well. And thank you for having me on. And yes, it's phenomenal to see your beautiful face again.
You're so kind. And a great liar too, by the way. Hey, Lennox, I want to jump into this. Now, typically this podcast series, we really focus on solutions for large self-funded employers or third-party administrators or large insurers. But, today you're bringing us a solution that addresses significant cost issues for the small employers, right? Can you give us like an overview of that solution and that you have for that market that perhaps disproportionately struggles than the large health plan sponsors when they talk about offering affordable health care to their employees?
Absolutely, Ed. I typically specialize in groups of 49 and fewer employees for obvious ACA reasons. Now, that does not mean that we cannot bring this to significantly large companies, because we do, and we offer a hybrid plan so that they remain ACA compliant. But let's stick with the smaller companies. So health sharing is what the concept is. It's been around for many, many years. It started back in the day when churches wanted to help, people to get good quality healthcare. So what basically happened was everybody put money into a little bucket. Okay, somebody needed to get some doctor care or whatever it may be. They were able to dip into the bucket and pay for those costs. So it's really like a co-op, if you like. And you're a smart financial guy. Let's say that you and I were part of this group. And we say, Ed knows something about counting chickens. Let's put Ed in charge of the finances. So you would manage those finances, right? Let's now go to a modern day solution of healthcare sharing. Okay. I represent a company called Impact for this particular variation of providing healthcare plans. And Impact has license from one of the largest technology companies on the planet, an AI technology to manage their healthcare plan offering. So basically what happens, Ed, is similar to what I just explained on a more simple basis. Each of us as members, we have money taken out of our checking accounts every month. It goes into a decentralized pool. By that, I mean, we each have our own accounts. Unlike with health insurance, it goes into the coffers of the insurance company. They take around 40% for profitability, and the rest goes towards care and administration. Now, as a non-profit organization, Impact does not do that. The money stays in our accounts. Now, when somebody needs care, the AI technology literally goes into each account using an algorithm, which tells it how much money to take out of each of those accounts. So a little bit comes out of everybody's account and is paid directly to the provider. That's a massive difference between what we're doing with healthcare sharing and traditional insurance. But the coverage, by and large, is richer. So, for example, we have deductibles as low as $2,500 and as high as $10,000. But what's beautiful about this is the co-share is a 90-10, whereas typically with health insurance, I'm seeing 60-40, 70-30, 80-20.
So, quick question for you. You said this kind of compares to church plans, but it doesn't sound like this is restricted to any type of affinity group. Is that correct? Maybe you can give us a kind of an understanding of the typical, employer mix or market that you target for this.
That's a really good question. I'm glad you asked it because I didn't mention it. So basically, like you say, with those church group type healthcare sharing plans, you have to be a Christian or you've got to be a member of the organization which has instituted it. What Impact has done is taken what we can call Christian-based faith health sharing plans, and made it a moral based, right? So it's all inclusive. So long as you live in the United States, have an ITIN number, if you're legally working here, or have a social security number and an address here, you can be part of the plan. Another thing that's massively different, Ed, about Impact versus most other healthcare sharing plans is that they are reimbursement plans. Now, that's fine if you go and have a $75 copay, you know, for a doctor's visit. But if, God forbid, you had something serious, you had a $250,000 bill, I would say that maybe 1% of the population could find that money right away. So Impact works just like health insurance, where the bill is submitted to Impact from the provider. Impact negotiates that bill down, and then, you know, the member would pay its his or her deductible, and then the 80-10, sorry, the 90-10 plan kicks in terms of a co-share, up to a maximum of 5,000. Okay, which again is very low compared to most insurance plans.
Now, you made a comment there. I want to touch on it. It sounded like this is not only a solution for small employers, but maybe individuals as well.
100%. So we have plans for individuals, families, and also a specific plan for Medicare eligibles as well.
Oh,
It's very, very flexible. I focus mainly on small businesses because my brokerage is a commercial insurance brokerage, and I have clients who wanted this. So I found this said, you know, it was like sort of manna from heaven, if I could put it that way. I was looking for a solution for small business owners who wanted to provide something in the healthcare space, but couldn't afford it. And they know, and I know, that when you can, recruitment and retention are much, much easier. So this really was something that I found and was more than thrilled to provide it to my clients.
so talk a little bit about how Impact negotiates with the providers. I'm assuming that's kind of a major piece to the ability to kind of keep the cost affordable for these small groups and the individuals. So how did they go about doing that? And you know, what's the secret sauce here?
Okay, great question. It's not really that secret, to be honest. You know, as you know, the Centers for Medicare and Medicaid do have guidelines. And so Impact bases their negotiations on those guidelines. Now, unfortunately, with this game we have of insurance, you and I both know that providers will typically submit a bill that's ridiculously high, knowing that they're going to be negotiated down, right?
Right.
So literally 95% of the negotiations that Impact has with providers, they just accept the first offer that Impact gives them. Now, in the 5% of cases where they don't, Impact will still pay that bill. Now, we've been around for 5.5 years, and we've paid 100% of claims where they have been legitimate. So if somebody says on the application, I've never had a heart attack, they then make a claim 2 weeks later, and we find out that they had one 3 weeks ago, of course, that will be denied. But every legitimate claim has been paid in that time, because as you can imagine, this is an organization of members who have committed to paying the bills of other members when it comes to healthcare. So there's an incentive to pay bills, whereas in the commercial insurance world, the incentive is to not pay bills. And some of them, very large ones, have doctors who examine every bill that comes in. And there is one large insurance company that told them to deny every claim that came in. And if it's submitted a second and third time, then we'll look at it. So their motive is to be profit-based, which is fine. I believe in making money. That's why I've got my own business, but I want to do it ethically. Okay. And sometimes insurance companies are on the verge of ethics. And I'm not just saying that. You can Google health insurance litigation, and some ugly stuff's going to come up.
Just read the Wall Street Journal today. By the way, we're recording this on July 10th. So if you want to go look at a couple significant Wall Street Journal articles that are talking specifically about what you're addressing, Lennox.
There we are.
Yeah.
And the Wall Street Journal is like the Bible of news. So
yes, sir. Yes, sir. And yeah, it's a great source. I love a lot of the articles out of there, and we actually get it through the CCA, so it's a nice benefit we have. Hey, Lennox, you mentioned you know, the use of artificial intelligence. So give me a little bit of an understanding of how that really you know, how that really benefits the individual member.
That's a great question. So I see that in two specific areas. I'm going to talk about the prescriptions first. So each member in its portal has a back office, and in that back office, they can access every single pharmacy in the United States, every single one. So what the AI technology does there is to allow a member to literally search by zip code, state, or by a particular brand of pharmacy, and get the best pricing or the most convenient location. So I'll give you an example of one gentleman I recently helped. He had an insulin pen that was costing him $180 to get every time he needed it. I went online with him to his portal, and we got it for $26, like 3 miles away. He could either have that delivered or he could go and pick it up. So that's one use. The second use, which I think is the most impressive, is something I mentioned just a little bit earlier, and that is the algorithm that goes into each individual's account to determine how much is coming out of whose account to actually pay the provider's bill. Now, that technology is really lowering the cost of us providing this benefit. So I gave you the example earlier where you and I and a couple of other people, set up our own, and you were the treasurer because you can count chickens, right? So the AI, the algorithm is actually doing the counting, if you like. It's doing the accounting for the plan. So Impact doesn't even see the money. It doesn't go into a central account with Impact. The algorithm decides where the money is coming from once we've paid our monthly share. I hope that makes sense.
Yeah, it does. And I don't mean to kind of go back to the Wall Street Journal article, but it's very specific to what you just mentioned about pharmacy costs in terms of where many of the large PBMs are directing patients to prescriptions that perhaps maybe 800 times more than they may have got it somewhere else. And I think that's something that the article at least suggested that the Federal Trade Commission is starting to look into. So I think the technology that you have behind this is certainly working to the benefit of your members, and that's what I really look to see what AI can actually do, because I think it can do a lot in healthcare. But that's maybe a completely different podcast from this.
What's crazy about that, Ed, too, is you can literally go to 2 different CVS's, let's say, that are within 200 yards, and they've got different pricing on the same drug.
Right. So do you have like an idea of how the cost of this Impact plan might compare, say, to like a traditional large self-funded employer's plan, or maybe it's better to compare it to a small group plan, an insured plan?
Sure. So what we're finding is that we're saving both individuals, families, and small businesses between 30 to 50% on what they're paying for
Wow.
insurance traditionally. Now, it's incredible. So literally, let's just say that you are a small business owner. You have, I don't know, 20 employees. 90% of the time, you're going to pay for the employees' healthcare, but not the families. What we're finding is that when we put a family on this plan, it's just as costly or least costly as it is to just have the one employee on the plan. So now the employee is covering the entire family for the same cost that he or she would if it was just him or her on the plan. So employers love that, because now their cost hasn't changed, but they've now got the entire family roped in. And what that simply means is that that employee is going nowhere, right? Because they're not going to get that anywhere else. It makes employees very sticky, and it's a very attractive pull as well to recruit.
I see.
And in terms of the actual pricing, if I can give you real numbers, if I were to look at an individual plan, Ed, is going to be somewhere starts at $73, right, a month.
Okay. Wow.
Now, a family plan, the highest I've seen on a family plan is $605 a month. Okay. Now, we max out at a family of 3. And what I mean by that is that we do cover families that are larger than that, but it's the same price for a family of 3 as it would be for a family of 20.
Okay.
Okay. And that cap is at around $605.
Okay. So are there any different tax implications here as compared to, offering a traditional insurance plan?
No, so long as the employer is offering it as a benefit,
Okay.
you can pre-tax this, and they can take advantage of the tax code.
I see. Great. And what do you see as the acceptance rate among kind of large plan sponsor, or I'm sorry, small plan sponsors?
Right. So it's difficult to give you like a real percentage. And what I would say is employers in that smaller category that want to provide health insurance, once they see this, I'm getting like a 70% success rate, which I've in my entire career,
Wow.
I haven't seen anything like it, right?
Yeah.
So if I categorize employers into two categories, ones that really don't care about providing benefits to their employees, they just see them as part of their, their wealth creating machine, which is fine. And those who generally want to look after their employees in that pool, that latter pool, I'm getting a 70% success rate, which is incredible.
Wow, that's tremendous.
And
Is there anything that I didn't ask you about that I should have?
yes, sir. So one thing that you and I know is extremely important, not only for insurance companies, but for employers as well, is persistency, right? So in my business, generally speaking, I'm seeing a 65% persistency rate, but with this impact service, I'm seeing a 98% persistency rate. So we're losing 2%, and we're losing them to things like death, to the fact that they may have their income has significantly dropped, so now they're on Medicaid, or they've left the country. Once people get on impact, they don't want to change because it's a richer plan at lower cost.
That's amazing. That's a great story, Lennox, and I appreciate you kind of sharing that with us. Lennox, I usually kind of wrap up a lot of these with a discussion. I usually have a question about kind of what's your passion, what would you be doing if you weren't involved in health insurance in any way. However, I do know a little bit about you because I've known you for a while, and I know that you're a published author of several books, two of which I know are entitled Embracing Failure, Your Key to Success, and the other one is Creating a Fulfilling Life Through Spiritual Growth. So, given that you're this published author on these great subjects, I'd just like to see if you have any, quick words of advice for our audience here today.
Absolutely. I appreciate that. And thank you for telling everybody about my books. Maybe I'll send one.
That gives me a discount if I buy it, right?
Absolutely. It's really built into the algorithm, Ed. Look, my favorite of the books I've written is definitely the last one, which is Creating a Fulfilling Life Through Spiritual Growth. Okay. And in that book, I give people some really good nuggets in terms of how, personal growth can effectively change somebody's life. But the nugget I'm going to leave you guys with is from Embracing Failure, Your Key to Success. Now, that book, I'm going to just be honest, it came out of a massive business failure when I was living in England. And I didn't know what on earth to do with it. I'd never failed at anything before it. I genuinely didn't. When that happened, I started journaling to understand what I did wrong and how I could never fail like that again. It was very painful. My wife at the time left me. She took the dog. I was destitute.
Oh,
and I started doing things like meditation, Tai Chi, yoga, anything to kind of change, who I was. And honestly, I was meditating one day and it was this incredible epiphany. And it was almost like a voice saying, this is not just a journal for you. You have to write a book for people who have failed themselves and want to get back on the horse to success. And so I was like, wow. So I started just writing. And then I came up with an acronym for failure, which I think really is a good summation of what it actually is. It's not what we think it is. And that acronym is, there you go. I've forgotten it already. So the acronym for failure is a fruitful and informative lesson urging renewed effort.
wow.
So failure is no more than a lesson that we have to overcome. It's part of that personal growth, right? And there's no such thing as succeeding without failure. And the metaphor I like to use is if you're a tennis player and you want to be good at the backhand, you're not going to be perfect. So you've got to practice it and you're going to miss more times than you succeed. So failure is a path or a place that's on the path to success. It's not in a different direction. You've got to go through failure to get to success. And that's why I came up with that acronym, fruitful and informative lesson urging renewed effort.
I love that. And I'm a strong proponent of learning from your failures. I think we also need to learn from our successes too, because I think there's learnings there. Sometimes we tend to skip past them on both accounts, right? And I think those who do succeed real well learn from both. So I appreciate you kind of sharing that with me today and with everybody else that's going to watch this. Hey, I'd like to encourage all of our viewers who participate in our healthcare community to, continue discussion of some of the insights that were shared here today. Would love to kind of hear your comments. If you're a member of the CCA, you might, if you're not a member of CCA, I should say, you might consider joining. So not only you experience the benefit of the community platforms that we just talked about, but some of the other great benefits, like I mentioned earlier, we get a subscription to the Wall Street Journal as a part of being our membership. So certainly helps me kind of keep in touch every day. Lennox, thanks for being here today and sharing your insights and experiences about the Impact platform that you have and kind of the innovation it's helping to drive down costs. I'm sure our audience benefited from what you shared with us today.
I thank you very much, Ed. You are definitely my favorite actuary, and I do totally respect the work that you do in this industry because
you only know one, right? Right.
Actually, I do know two. You're definitely my favorite anyway.
Well, thank you again, Lennox.
My pleasure. Thank you so much.